It's tick season. What can you do to be as safe as possible? I'm Dr. Brian McDonough, KYW Newsradio medical editor. The biggest thing to look out for in tick season is the fact that you need to expect the unexpected. You might think there's no way that I have to worry about ticks. That might be when you have to worry about it. Ticks are going to like any area where there's shrubbery, grass cover, trees, woods, those sorts of things. And one of the ticks we worry about, especially with Lyme disease, is the deer tick. So, in many of the communities around the Philadelphia area, there are plenty of deer, and deer are actually transmitting the ticks. The ticks then get into the areas where you or your dog or somebody might be playing or walking. And that's when you can actually have the tick kind of hop on and transmit that spirochete, the thing that causes Lyme. There are all sorts of ticks out there. The one that we worry about the most common one at this time of year and also in our area is the deer tick. Now, it's hard to describe what a tick looks like, but it almost looks like a freckle on your skin. It's very small and it's dark. But the bottom line here is if you have any question and you can actually get the tick, put the tick into a plastic bag. You can show it to your doctor. You can actually now in today's world send it via an image to your doctor who then can tell you the type of tick it is or give their best guess. So if you have an opportunity to grab that tick, I would. But it's the deer tick we worry about for transmitting Lyme, which is what we're talking about today. One of the best ways to remove a tick, if you can do it and if there's time, is actually to use tweezers and to pull at the tick. Because what you'd like to do is you like to get the entire tick and not leave any part behind. But the reality is you want to get that offending agent away. And then what you have to do is realize that if there has been blood that has been withdrawn or any kind of communication like that, even removing the tick, the infection could already be there. So you have to watch out for the signs and symptoms. And that's really important as well. Just removing the tick doesn't mean you've avoided the problem, but certainly the quicker you remove it, the better. So how do you know you have Lyme disease? Well, it's really what we call a constellation of symptoms, different things that are happening. For instance, you might feel feverish or fatigued or not feel as well. Or you may see a rash. The classic rash of Lyme disease is what we call a bullseye shaped rash. And that rash can look like a bullseye, but that fools a lot of people because they hear about the bullseye rash and they never see a rash and they say, oh, it wasn't Lyme. Well, the rash doesn't always come. So that's not enough. So what we do is we actually find out if someone thinks they've been exposed. They come to the office, maybe they've been feverish, they're not feeling well, some of those early signs. We can actually test for it, and we can test to see if there was exposure to Lyme. So it isn't like you have to guess. You can actually be tested for it. Why is it important to test for it? Because you can also be treated. You can be treated with antibiotics. And the thing that is most important with Lyme is if you have it, you want to treat it as early as possible because like many of these tick-borne illnesses, there's a short-term period where you have problems and then a long-term period. So short-term, you might be fatigued, you feel ill, you're feverish, you get that rash. But down the road, it can cause things like joint pain. It can cause Bell's palsy, where you get temporary paralysis on one side of the face. You can have issues with arthritis, issues with neurologic problems. And in some cases, if it goes for a long time and it's not recognized, you can have long-term issues where you're dealing with what we call long-term sequelae of Lyme. And that's what we're obviously trying to prevent. I know I'm talking a lot about Lyme disease and all these issues, but I do have good news. This is one of those things where if you catch it early and you treat it with the antibiotics that we have on hand that are very effective, you can actually nip it in the bud and avoid those long-term problems. And again, that's why we're talking about it now. If it was something we couldn't do anything about, we'd be frustrated and we'd be kind of moving our way through the summer. But the reality is, if you recognize it, you want to treat it, we treat it, and then we can eradicate it and it can be part of your distant memory. And there's people who have had Lyme multiple times because they're out there, they work in industries where maybe they're in the woods a lot, but if they're treated and they're treated effectively, they don't have to have those long-term issues. But, initially, we're all going to kind of get that exposure if we don't see the tick on us and it gets a chance to basically infect us. Have a question? Email me at AskDrBrian@kywnewsradio.com.